Good Monday morning and welcome to week 6. This is the walkthrough for your final week in this growth and development course. It's been a quick and wild ride, but I feel like you have learned a lot and I have enjoyed having you in the class. The paper is done, yay. And so we are moving on into this final week. So I will give you the rundown here. So I again am on the home page. You have recent announcements. I will have office hours tonight. I will post a link for those. The quiz for week 6 will open on Wednesday and close on Friday, maybe Saturday, because the course ends on the 6th. So today is August 1st, which is Monday, 2nd, 3rd, 4th, 5th, 6th, which is Saturday. So you don't have the whole weekend in order to take the quiz. So that's why it's going to open up early this week. When I'm done going through all the week 5 assignments, I will update the achievements for week 5 that you have completed. And then moving on into the overview. So for this final week, we are going to look at older adults and physical changes, developmental tasks for the older adult, nutritional requirements, health promotion, and then we're going to move into end of life, death and dying, and grief, especially in this time coming out of the pandemic. I was just at a retreat this weekend and we talked about grief and how to work through grief over what we've experienced the past couple of years as healthcare providers. So that will be the last piece of information that you will learn in this course. You do have your assigned reading. You have your Overstreet pages that you are looking at. And then let me see, let me get to, there we go. And then you also have some chapters from another book that I've included. And then this is from the Lally and Valentine French book that you have as well. You can download that, or you can, you probably already have that downloaded to your computer. And then in terms of the activities for the week, you have your key terms. And so remember that there's 10 key terms. Again, if you use them in a sentence or write a paragraph that incorporates all 10 or however many terms, you will earn half a point for each word that you use. And so that will be in addition to the 20 points possible for the assignment. So many students have done that. I encourage anyone that has not yet done that to do that. And let us go back to see and watch the due dates, because some of the due dates are a lot earlier this week. So Thursday, Friday, those will be your due dates this week. And just so you know, for week 4, I think I took away all the late assignments. That was a rough week for people. I got a lot of emails and contacts from students saying that they were unable to complete assignments on time that week. So I just went ahead and took away any late assignment penalty points for that. So if I missed that for you, let me know. I will go through again and look at all the assignments for week 4 and 5. And if there's a lot of late things in week 5, I may consider doing that for week 5 as well. We're going to come back to the capstone in a minute. So moving on to your lesson, you have a lesson on late adulthood, and then you have your final, yay, late adulthood growth and development template. Those are coming along, doing much better. Remember to include the names of the stages, the theorist. And then you have a learning activity, pictures and perceptions of aging and older adults. And so the due date for that will be Friday. Betty White was one of my favorite actresses. She's just absolutely amazing. So I like this quote. I may be off my rocker, but at least I'm not talking to it yet. So for this one, the goal is to look at what it's like to be elderly, and to look at how you feel as a healthcare professional in caring for the elderly, because not everybody likes to care for the elderly. I personally prefer to care for babies and children. I do also care for the elderly, but that's a great thing about healthcare, is that you can choose which age group or multiple age groups that speak to you. So what you're going to do for this is not a discussion. This would be, I guess, a paper. So include a picture that depicts how you feel about the elderly, and then write a paragraph that explains your feelings and why you chose that particular picture. It can be a picture, it can be a piece of artwork, anything like that, that portrays how you feel about the elderly. And then to think about how it must feel to be admitted to a long-term care facility. So imagine that you're an older adult who's being admitted into a long-term care facility. It could be for long-term. It could also be for rehab. Say, if you'd had heart issues or a hip surgery, maybe you're going in for rehabilitation. And so describe your feelings, how that might feel to you, and especially taking into consideration the stages that an elderly person would be in, formal operations for Erickson, having her PAC as well. And then as that client in the long-term care facility, what attributes of a healthcare provider the caregiver would be important to you, the person that's taking care of you? What would you want them to be like? And so make sure that you include and explain at least one of the principles of elder care, some point in your discussion in the paper. It's not a discussion, but the paper. And so you can find these in the lesson in the lessons from the week. And so include one of those. So 3 paragraphs. 1 paragraph for number 1 and 2 paragraphs for number 2. Use at least one example from the lecture or the reading or the supporting materials. This is the principles of geriatric care can it help improve care, which looks like that didn't carry over. So I will make sure that carries over. I don't know why those don't work. It just is very embarrassing, and I apologize. I will make sure that works. But the principles are listed in that article, and that's supplemental material. All right, so let's go back to the overview, and we will look at that lesson on late adulthood. So there's the lesson. This will take you back to the module, and you made it to old age. Yay! There's your weekly outcomes, your reading. There's more information about late adulthood. Vaccine schedules. Who knew that there were all these different kinds of vaccines? There's your template, your key terms, pictures of perceptions, any supplemental materials are all here. And I believe those should work, because I thought no. All right. I don't know why they didn't work there. I will make sure all the links work. I apologize. And if y'all see that there's a link that's not working, please let me know, because I don't necessarily notice that it's not working. Okay, moving on to the process of dying and end-of-life care. 1 assignment, geriatric healthcare provider role in end-of-life care. And so you want to write at least 1 paragraph that answers both questions. Or you can write a paragraph for each question. And please, again, remember developmental theories to include those. You don't need a reference. This is your opinion and reflection. And so what do you see as the role of the geriatric healthcare professional, or as someone who spends a lot of time with the elderly? What is your role in caring for this person? What are you trying to accomplish? What are you trying to help them accomplish? And then what is or could be the role in end-of-life care for the elderly and with their family or significant others? So in other words, you as the caregiver, the healthcare professional working with an elderly person, what is your role? And so in terms of just caring for elderly people, but then also moving into end-of-life care, how will you help the person with that transition and their family with that transition as well? And then talking about compassion fatigue. A lot of people, just by virtue of being a healthcare provider in any capacity, you are set up to experience compassion fatigue because we give. And so this is just a little check-in for you. Some of you are in healthcare. Those of you that are not, it's a way to understand how we can self-reflect and figure out where we are in this continuum and what we might need to do for ourselves. And so there is a video. Yes, it's 17 minutes long, but it's a very good video that explains all about compassion fatigue. And what I'd like you to do is answer these questions, 3 and 4 here. I believe that's it. Yeah. And think about, where do you fall on this continuum at this moment? It doesn't have to be healthcare related, just in general, especially what we've been going through these last couple of years. Are you in the green zone when you're happy and productive and emotionally stable and everything's going well? Are you kind of in the yellow when stress and lack of coping start to occur? Or are you actually in the red where it's chronic stress and you respond and there's little control over what's going on? So think about that. And then what do you do to care for yourself? What are some things that you do that help you stay in the green, get to the yellow, get out of the red, some of those types of things. And so that should be a paragraph there as well. And due by Friday, August 5th. And then you've got your rubric there as well. 2 activities for self-care, right? Where do you fall? Why do you think you fall there? Okay. And then we'll look at that lesson for just a moment. So lesson 6.3. There we go. And the outcomes, the weekly outcomes, there's your reading, PowerPoint. This particular video is the PowerPoint and the video, depending on where you are in terms of your life with significant others, family members that might be going through the dying process. The PowerPoint and the videos can be a little difficult to watch. They can bring up a lot of emotions for people. So I'm just putting that out there ahead of time. But I really like this particular video because the person that's speaking is a former nurse, and she's sharing her experience with nursing students who are caring for her at this time. And it's a really powerful video and very enlightening and educational for the students. We reviewed the assignment. And then supplemental materials, make sure that you read about Bowlby's stages of grief and Worden's 4 tasks of mourning. You'll have that in the next, in the grief lecture as well. We all have heard, or most of us, I believe, have heard of the Kubler-Ross stages of grief, the DABDA, denial, anger, bargaining, depression, and acceptance. Bowlby and Worden, and there are many more, but these 2 are the ones that we focus on in this class that talk about how to mourn, the stages of mourning and the stages of grief. And then there are some videos, again, take care of yourself, but what to expect in the final weeks and days of life, what death looks like from actually nursing students' perspective, what happens to a person's body, those types of things. So, and let's go back to our homepage. And then the 6.4 lesson, grief and mourning and bereavement. You need to know the difference between those terms. So let's actually go to the lesson and we'll get to the assignment from there. So not as many assignments as in previous weeks. So discover similarities and differences between grief, mourning, bereavement, compare and contrast people's different reactions. This is a little poem by Deanna Edwards that I think is very poignant and kind of speaks to me, so maybe it will speak to you as well. Our learning outcomes for this particular lesson, there's your reading. There are the lesson, the PowerPoint, and the stages. These should be the same links, and I'm pretty sure, no, okay. Yes, they do. I will check all of the links. I am so embarrassed, but that's okay. I will fix them. And then this is a video, a TED Talk about changing the way that we mourn, how we think about that, what we can do to help ourselves. And then different grief and bereavement theories. How can you measure grief? And then this is another really powerful TED Talk that I like about talking about that we move forward with our grief. We don't move on from grief. We move forward through it. And so that's another good TED Talk there. And then for the assignment, dealing with grief, reflect on your personal grief reactions. And then there's a poem that you're going to read and kind of interpret the poem, and to help utilize the poem to maybe help someone to begin to recognize and move forward in their grief. You're not required to post references. These are personal reflections. If you want to, you can. But part one goes into reflecting on losses you've experienced in your life. How did you react to those losses? Did you know they were coming, which would be anticipatory grief? Is there anything special that helped support you through that time, and write at least a paragraph on that topic. As you go through that, the PowerPoint for this, it doesn't have to be, the loss doesn't have to be a death. It can be any type of loss. We grieve anything that we had and no longer have. So you certainly can put it in terms of that. And I think it's good to separate those types of grief from one another. And then once you've reflected on your personal reactions to loss, like how you react to loss, I want you to think about how you can support, you as a healthcare professional or just in general can support someone through their grief process. So there are 4 different methods of support listed here, and there's an article for you to look at to give you the definitions of those, and choose one method of support from the list and describe how you could use it to support a grieving person. Identify the person you're supporting. Would it be a parent, a child, a spouse, sibling, friend, etc.? And then a rationale for why you chose that particular method, and you want to write at least a paragraph. So for example, popular ones are really leaving room for silence and making room for tears. I think in the nursing program, individualizing care really comes through a lot. But I think even just acknowledging their loss, somebody acknowledging the loss can be very important as well. So that's a paragraph. And then part 3, this is the poem. It is also in the video in the PowerPoint at the end of the grief PowerPoint. Hospice provides it. And it talks about for people who have experienced the death of a loved one, family member. And then reflect on and answer the questions in at least a paragraph. And understand that everybody experiences poetry, art in different ways. And so some people may not understand the poem, and that's okay. Just do your best. Some people may be really moved by the poem. And so again, just do your best. There may be just 1 or 2 lines that speak to you, and that's okay too. It's your interpretation. Art is experiencing life through life and death, grief through art is very personal, but it's also a way to get in touch with how you feel so that you're able to help others with how they feel. And so what does the poem mean to you? How do you interpret the poem? And then how would you imagine that you might use this to support a grieving person? You may choose to answer that you don't think you would use this to provide support. Some people really love this. And then other people are like, no, I think this is a little too deep. I'm not sure that it would really help somebody. And that's okay. That it's how this particular method speaks to you. And that's fine. It's called Gone From My Sight. It's actually, it's credited to Henry Van Dyke, but it's thought to be written by Harriet Beecher Stowe's cousin, Reverend Luther F. Beecher, first published in 1904. So it's been around for a very, very long time. And here's the video again. And let me read it to you just because it might help. I'm standing upon the seashore. A ship at my side spreads her white sails to the morning breeze and starts for the blue ocean. She is an object of beauty and strength. I stand and watch her until at length she hangs like a speck of white cloud, just where the sea and sky come to mingle with each other. Then someone at my side says, "There, she is gone." Gone where? Gone from my sight. That is all. She is just as large in mast and hull and spar as she was when she left my side, and she is just as able to bear her load of living freight to her destined port. Her diminished size is in me, not in her. And just at the moment when someone at my side says, there, she is gone, there are other eyes watching her coming, and other voices ready to take up the glad shout. Here she comes. And that is dying. So I will let that sit with you for a moment. We'll go back to the week 6 overview. And I believe that is what you need to know. We'll look at the capstone reflection. I've had a few students one student turned that in already. And they turned in a PowerPoint, which is fine. Google Slides, PowerPoint, Prezi, something creative. So again, you're going to choose a show. It could be a movie, Netflix, Amazon Prime, whatever people are watching these days, Hulu, a series, a movie. It could be a cartoon. And again, I had put together an example of what would need to be included. And the purpose of this is your final exam. This is called a capstone project, meaning it's giving us a review of the entire course and the things that you have learned in the course. And so what you're trying to do is take the growth and development principles that you have learned in the course and apply them to something that maybe a lot of people will know. And so it's kind of a fun thing, I think. And so you're applying the concepts. It's one of your course student learning outcomes. And so what you want to do is identify the family and the source. So for example, if you chose Modern Family, that would be the series, and you got it, I think it's on, I don't know where it's on Netflix, wherever you got it. What type of family are they? Now, Modern Family, there's different types throughout there. So what type of family? How do you know what type of family? What clues do you have? What do you see as in your assessments? What stage of family development are they in? Couple? Are they a couple? Are they child rearing? If it's an older couple, maybe they're retirement or empty nesters. Is the family functional or dysfunctional? And provide an example. They could be both. In fact, many of the ones on TV and movies are both. Aren't we all both? We're all both. And give an example for each of functional and dysfunctional. And so that would be from a specific episode of the show that you're giving an example of. Introduce 4 of the family members. They must each be from a different developmental stage. So you can't have mom and dad who are both in middle adulthood. You'd have to have like grandpa. You could also have someone who is pregnant. I will accept that as a separate developmental stage, prenatal. Their name, their age, their occupation. What is their role in the family? Not just are they the mother, father, but like, are they the fixer? Or did they stir things up all the time? What is their role? And then their developmental stage. And then for each of those family members, what is a health concern that they would have? Now, it could be an actual health concern, because a lot of times on the shows, somebody has heart disease, or they're overweight, or they get cancer or something. So you can use their actual health concern, or if there isn't an actual health concern, you could do, what might they be at risk for? Maybe a teenager would be at risk for alcohol or drug misuse. And then for each of the 4 members, describe their psychosocial development according to Erickson. So what stage are they in, what should they be accomplishing, and where are they actually? So I like to use The Simpsons as an example for that, because the kids, Homer and Bart and Lisa, are not, according to their age, acting really how we would expect them to act. So you don't need to provide references for this. Have fun thinking about your favorite show and characters, but put in pull it together, like pull the whole, everything you've learned throughout the course, pull that together. How do they, how do they communicate? Is that part of their functionality? Those types of things. So, and you do have a rubric. Sorry, there goes again. And you do have a rubric, and it is worth 50 points, and that tells you where your points are. And so notice there's only 2 points for the creativity. The major part is here. So make sure that you read through the rubric and putting your presentation together. And then let's go back to, that's the module. Make sure we've shown you everything. There's 2 more things I need to show you. So there's the overview, there's your lessons, there's the reflection, no discussion, because you're doing these other assignments, your key terms, your template, and there's your 3 assignments. Again, remember that the quiz opens on Wednesday morning, and it is already done, so it should open, it is published. And then I would certainly appreciate your feedback on these 2 surveys. The course feedback survey wrap up just talks about when did you feel engaged with each other, with me, what you have, what might have helped you, things like that. It's anonymous, so it helps me make the course better and give suggestions to other instructors who are teaching the course. And then the course feedback for meeting objectives. I apologize for students that took this previously. I had moved it over from my public health class and had not changed the objectives. So now the objectives actually match this course, not the public health course. So for those students that did complete it earlier, you have another attempt on that. And so this one just goes through each of the course objectives. There's 16 of them. And do you feel that by the end of the course now that you are able to do that, meet that objective? And you actually, this one is not anonymous because it doesn't really ask for comments. It's just, do you feel, do you agree, strongly agree, disagree, strongly disagree? But for completing it, you do earn 2 above and beyond points. So, so you have that. And then I won't have the week 6 accomplishments done yet until after everything gets turned in. So I will leave the course open for a few days after Saturday if you want to come back and view that, and I'll post an announcement so that you can, that you'll know that that's available. So as always, you know how to get a hold of me, and I will take you back to the home page, and it has been a pleasure. And let me know, again, I'll have student hours tonight and Wednesday, and have a great week.